There are multiple ways to diagnose somatic dysfunction of the carpal bones. One way is to perform a general assessment of the motion between the carpal bones by taking the wrist into flexion, extension, abduction, and adduction. In addition, minor motion glides can be useful for identification of carpal restriction. As the motions can be quite subtle, comparison with the unaffected limb can also be helpful. The carpal mobilization technique addresses carpal bone restriction of motion in any direction. With the patient in the supine position with a pronated forearm, the patient's palm facing the ground, the physician places their thumb pads on the proximal carpal row while their fingertips are in contact with the thenar and hypothenar eminences of the affected hand. The physician then brings the wrist through full flexion and extension while adding radial and ulnar gliding. An important component of the treatment is when the wrist is brought into full extension, the physician's fingers apply lateral traction to the thenar and hypothenar eminences and simultaneously apply a distraction pressure to gently separate the carpal bones. Gentle articulation is often appreciated by the patient and physician. The physician reassesses by examining the carpal bone motion after treatment. It should be especially focused on areas of potential neural entrapment and other key areas including the cervical and thoracic spine, thoracic inlet region, the first ribs, scalene muscles, and clavicle, pec minor and upper rib cage, shoulder, elbow, and forearm.